guest, Dr. Amy TRAORE, SHOMBUSHO, believes the mouth is the gateway to the body, and as a result, oral health goes well beyond having white teeth and good breath. She joins us now to tell us about this and the World Orthodontic Health Day holding today. Dr. Amy, welcome to the show. Thank you very much. Happy World Oral Health Day.
Thank you very much. Thank you, Femi. Thank you, Fade, for having me. And today is the 15th of May, is the World Orthodontic Health Day.
Nice.
Yes. And as the president of the Nigerian Association of Orthodontists,
yes,
I'm glad that you have me on the show.
Oh, we're very glad to have you.
Orthodontic,
exactly.
Orthodontists, and for people to get to know what is that word.
Exactly. Thank you.
My mom still struggles.
Yeah.
She's like, what is that ortho something?
How is that different? How are orthodontics different from general dentistry?
Wow, good question. You have in Nigeria about 5,000 dentists, and a little over 50 are orthodontists. So let's say about 1% of dentists are orthodontists. So ortho, simple. In the Latin word, ortho means straight, just like orthopedics, and then odont means tooth, okay? So an orthodontist is a dentist that straightens your teeth, all right? But we know that straightening teeth goes beyond having a beautiful smile. It has to do with building the foundation of your teeth. So let's say that an orthodontist is the architect, the engineer of your mouth. So you cannot really function without an orthodontist giving you a clean health bill to say that, you know, you're good to go, your teeth can function and not just look nice. It's important that we have that function.
I've never visited an orthodontist, for instance. So how lucrative is orthodontics in Nigeria, considering that people barely even visit dentists? What more, orthodontists?
Very good question, Fade, because I will tell anyone that is looking for a profession where he will never have to look for a job a day in his life is to being an orthodontist, okay? Because we are very few in the world, and because we are very few, there is a demand, but my presence here today, thanks to you, is to create awareness. You know, people knowing what orthodontics can do for them. You know, orthodontists, of course, if I refer to the World Health Organization that says that having a good oral health, a good health, goes beyond having physical health, mental health. It has to do with having a social well-being. That's also very important, especially in these times. And an orthodontist helps you in that way by straightening your teeth and having a beautiful smile, so socially you're comfortable.
Absolutely.
You know, you feel good, you're confident. And that aspect, I think, is something that we don't talk enough about, you know, having a good social well-being as part of being healthy. I think it's something that we're here to push.
No, I totally agree. I actually wore braces twice, once when I was 15 and again at 27, which was a few years ago.
Yeah, why was that? Why I mean,
exactly.
Why did you have to use braces twice? Separate times?
Well, it's two different issues. So firstly, when I wore them as a child, it was to improve an overbite. And I just thought, okay, well, fine, had them put in. And then as an adult, I had lots of gaps in my teeth. Okay. So right in the front, in the sides, my bottom row had a gap in the middle. And just in terms of a cosmetic appearance, I just wanted to improve that. So, Dr. Amy, I wanted to ask you about, well, telling our viewers about the different ways people can improve the way their teeth look, because I had normal, linear braces, the silver train tracks, as you call them, in the front of my teeth, at the top and at the bottom. And, you know, for the first week or so, it can be quite uncomfortable because it tears against your gums. But then afterwards, you get really used to them. And when I had them taken off, I almost feel a bit of a, But what you said about it improving your overall confidence, that's the day you get your braces off, you just feel like a whole new person. So if you could show us, I know you've got a few different props here about the different types of orthodontic care people can have. I think that'd be really interesting.
I came prepared for you, and I have a couple of props here to share. But what I would like to say is that it's never too late to have the smile you've ever dreamt of. So 7 to 70, I even have some 80-year-olds who are wearing braces thinking, look, let me know I've done this in my lifetime. So it's never too late. I think that's the message. Now, to your answer, most times when we're starting at a young age is really to correct the obvious, because our teeth are not straight, our bites, it's not functioning. There are things that are obvious to our parents or to the dentist, and usually we take care of that. But as an older stage and an older age, we look at that cosmetic side of it, okay? So that's really summarizes what orthodontics is all about. It's really about straightening teeth, giving you that perfect bite that enables you function. But at a later stage, you're looking at, what else? All right? And that cosmetic aspect comes in. And that's why with the type of braces, there's so much innovation and technology that has come into the braces, whereby, yes, you must have started with the regular metal train tracks. But now you know that the next to it is the clear braces, whereby they're made of clear crystal porcelain, where from a distance you only see the wire going across, you don't see the braces. This is amazing. A lot of adults go with the clear braces. You also have, I like to say the Rolls Royce of all braces, because it's totally invisible. It's what we call lingual braces. It's fixed behind your teeth. And then remember, technology has really affected the way healthcare is delivered, and even more in orthodontics. So you have wireless braces.
Wow.
Wireless, such as Invisalign aligners, that enables you move your teeth without having wires in your mouth. So you can live and you don't have to change your lifestyle, and your teeth are being straightened, whitened. Why not?
And how affordable are all these different kinds of braces? Would you say that the correction of malpositioned teeth is affordable? For instance, what do they cost?
Good question. Now, in terms of cost, it all depends on the problem. How long your treatment will last. Will the treatment affect your upper, your lowers, the front, the back? So in terms of affordability, I will say is really how much you want it, how much you need it. And we cannot put a cost to the appliance. The cost is to your condition. That's what determines how long and the complexity, the severity of your case.
Usually, give us, for instance, what's the maximum number, of years you have to wear braces for?
Good question. We have treatment that lasts about 3 years, 4 years sometimes, but I'll say the average is 2 years, 18 months now with modern technology. We even have some treatment that lasts about 6 months, depending on what we're there to correct. But count about 18 to 24 months as an average treatment time.
18 to 24 months.
Well, nice.
A couple of, you want to go ahead?
Sure. When it comes to dental health, for example, here in Nigeria, would you say that you're happy with the state of dental health, across the board? Of course, we're talking about orthodontics, but in terms of people having a natural relationship with their dentist, their families knowing that, periodically every 6 months we go for a checkup. Do I have a cavity? What is this pain in my tooth? Is there that relationship in Nigeria, do you think?
Good one for me. People need to know beyond the orthodontic health day that I'm here is to create awareness about oral health in general. And what people tend to miss out is the fact that a dentist is here to help you have a general health, because everything starts from the mouth. And in the mouth, we have millions of bacteria. If you have inflammation in your mouth, you have inflammation in your vessels. You have that inflammation that can connect with your heart, connect with your kidneys, connect with your articulations and joints. So you will have problems in your overall body, and thinking that it has nothing to do with the mouth, but the dentist can help you there. So just for that, I will urge Nigerians to take charge of their oral health. Visit the dentist every 6 months. We can spot out cancer at that early stage and prevent it from, expanding.
Of cancer,
oral cancer.
Oral cancer.
Yes, it's one of the top 3 cancers that are most, prominent. So it's important that, yes. And if you have some habits that are affecting you, stress is a big issue right now. And I can tell you with what is going on right now, more people perhaps are dying from sleep-related diseases, stress-related diseases, and these can be spotted by your dentist.
Right, because for example, not to interrupt you there, but sometimes people can grind on their teeth as they sleep. as a result of stress, and you may not know that, may not even be aware of that until you go to a doctor, and perhaps then they can even prescribe, a retainer or a night guard.
You've done your research.
I've tried, Dr. TRAORE. I've tried.
Yes,
for
dental work. I could see. Well done. So what I will say is that, for example, sleep apnea. Yes, you can grind your teeth, create some attrition on your teeth. But there's also the fact that with your bite, and this is where orthodontics comes in, you may have a deep bite, and that constrains the airway space. And then you find yourself snoring at night. Some people are thinking, that's perhaps me. Or waking up in the middle of your night, gasping for breath, all right? Just because your airway is reduced. And orthodontists can help correct that, all right? So these are some of the things that people need to know, that, a lot of things happens in the oral cavity that will impact your overall health and well-being in a positive way.
Well, let's look at how rewarding a career is in orthodontics. How rewarding is it?
It is. I could tell you that, I don't count that I'm working, that I have a job. For me, it's passion all the way. And most orthodontists are passionate about what they do. I mean, it's a lot of work, physically, mentally, and that's why in the way we study orthodontics, there's a lot of physics, biology, and it takes about 5 years after being a dentist.
Yeah, that's what I was going to ask.
Being
How
an
long
orthodontist,
does it take to qualify?
Yes, so I was in university for 12 years. My daughter is like, I'm not going to do this. I know it's a long one, but it's really rewarding because you are a specialist and you're able to spot and make changes in people's lives. Yes.
You're well aware as the president of the Nigerian Association of Orthodontists that their mid-year conference, which has concluded last month in April, focused on digital disruption in dentistry and the impact on orthodontics. Can you shed some light on that digital disruption? What does that actually mean?
Wow, that's a great one. So digital disruption, first and foremost, comes with the way we have to practice now. There's a lot of things that are digital has impacted the way we practice, where we literally don't have to bend wires because we have, CAD/CAM technology helping us do quite a bit of things. I've talked about aligners, where we program movement of the teeth in a very thin plastic, and then when you wear it, you have, so the digital disruption goes beyond the appliances, goes to the way we treat patients and how much we use technology to get people to understand what they'll benefit from, to the way the treatment. And of course, the biggest advantage is how shortened the treatment is and how comfortable, it is for patients.
Absolutely.
Yes.
Well, you make all this sound really interesting, but a lot of laymen out there don't understand the need for this, the costing of this. So we'll have you speak more on this right after this break.
Sure.
Just stay with us. You're watching The Morning Show. Time now for a quick break. Just stay with us.
Welcome back to The Morning Show here on Arise News. We're still joined by Dr. Amy TRAORE SHOMBUSHO, who is here to talk to us about the great benefits of oral health and obviously about the specification of orthodontics. Over to you, Fade. I know you wanted to ask a question.
Oh, yes, indeed. You say that oral health goes beyond having white teeth and good breath. But the layman would say, what more do I need? If my teeth are white and I have clean breath, fresh breath, what more do I need?
Okay. So, as I said originally, until proven otherwise, every single person needs an orthodontist. An orthodontist that could tell you, good, you're good to go. But a lot of times there are things that we can spot on your back teeth. It's not just about the front. It's not what you perceive. There are things that will be happening, and over time you will realize after a couple of years that, oh, why are my teeth moving? Why am I losing bone? And that's why the way we run our consultation, we don't just look at your teeth, we take x-rays because it goes beyond what we see. We need to look at the roots, the bone level, and seeing if you have a right bite and something that will preserve the health of your teeth over time, teeth and gums over the years. Okay, so it's not just what we see now, but we can tell you, watch out, something is going on here. and you want to make sure they take care of it now and not later, because you don't want to lose your teeth. We've passed the level where, oh, I'll get a denture when I'm much older. No, the same teeth you have now are the teeth that you want to keep when you're 100 years old. Okay, so.
What happens if, for instance, I just never visit an orthodontist, for instance, my entire life? What happens? What do I miss out on?
Okay, good. What I usually tell my patient, I always start by telling them, look, this is your condition. And I tell them straight away, this is what will happen if you do nothing. And it's your responsibility. If you have crowded teeth that are overlapping, you will know beyond the fact that the teeth are not straight and not perhaps having a pleasing smile, there are some areas where you can't brush, where food particle will get stuck and you'll have inflamed gums, risk of decay. And then over time, you see yourself, oh, what's going on to my tooth? I have to remove a tooth. And, you don't want to get there. Okay? So that prevention, okay, and treatment of this malocclusion is what an orthodontist is here to do. Okay? So is by assessing and giving you proper advice about the consequences of, what can happen if you don't take care of that condition.
Okay, for instance, I have crowded teeth on my lower teeth. What do I do?
Having to visit an orthodontist, having a
What's the
proper
process?
consultation. We take an x-ray, usually what we call a panoramic x-ray, to look at the roots, because we don't just look at what is what we shows is just 1/3 of the tooth. We need to look at what's going on in the root. What's the bone level? What's your quality of bone? And even before moving the teeth, there are perhaps other things we need to take care of. So it's really a holistic approach to your oral health. It's not just, oh, I want to straighten my teeth. It goes beyond. I mean, we are healthcare providers, oral health specialists, so it goes beyond just having that pleasing smile. But of course, we'll tell you, look, this is the benefit. If you straighten out your teeth, resolve that crowding, this is what will happen. You'll preserve your gums, you'll preserve your bite, okay? We'll have people that come, they have spacing. Teeth that are protruded, we see that a lot, here. And we tell them, look, when your teeth are protruded, there's a risk, especially in children, of having trauma, okay? Because when there's a shock with the face, if, there's a shock with the face, the teeth could get broken and fractured. And unlike the skin, where if you have a cut, it'll heal. Yeah. A trauma, when a piece of your tooth goes, it goes forever. You can't replace it. So that prevention aspect of bringing your teeth together, closing those spaces, yes, will give you a pleasing smile, but will preserve your teeth for the long haul, all right? It also helps you speak better. Because when your teeth are not in the right position, maybe you have what we call an open bite, because you had some habits, let's talk about that.
Yes.
Patient who had sucking habits, or even adults with tongue, when you have an open bite, you can't speak properly. You won't be able to pronounce certain words. Your elocution and diction will be affected. And communication is one thing that has brought you to this job, and it's very vital, in this world.
Can we talk about, the basics of, dental and oral health? How many times should a person brush? Is there too many times in a day somebody can brush? Even when you do brush your teeth, are you supposed to have a lot of toothpaste on the brush? Is it supposed to overflow in your mouth? That's definitely something I'm guilty of. Or do you only need a small amount? Talk to us about the basics of keeping our teeth clean.
Thank you for bringing me to that. As much as I'm an orthodontist and a specialist, I love to talk about the basics. So brushing is very important, at least twice a day. I will say every time you're eating, just like you're cleaning your plate, you need to clean those teeth. They're made of porcelain. The enamel is almost like the porcelain of, the plate where you're eating. So brushing, yes, the right toothbrush, a toothbrush that has been changed after 2 to 3 months. If the bristles are open, that's gone. The toothpaste, fluoride toothpaste for especially younger patients. And the technique is really what is very important. So here is a quick demonstration. If you're brushing, we always say brush your teeth. But remember that brushing your gums is even more important. Because the bacteria that I talked about, we have millions of bacteria as we speak. You probably have brushed this morning, millions of bacteria. And you want to make sure that if it's 1 million, it doesn't get to 10 million by the evening. So the technique is even more important. Brushing your gums, because the bacteria gets lodged between the gum and the teeth. So brush that area where the tooth is coming out of the gum and in a vertical motion, not horizontal motion. It's easier, but it's more up and down. Okay. Up and down from the gum to the teeth. For the lower, it's the reverse. From the lower gum to the teeth. And brushing twice a day for at least 3 minutes changing your toothbrush, having the right toothpaste, and having the right technique.
Talking about right toothpaste, I started having teeth shock. My teeth started shocking me. So what is the right toothpaste? I had to stop every other toothpaste but one. Why do we have teeth shocking?
Oh, that's great. And as adults, guess what? That's one thing that we really, really suffer from with the sensitivity of our teeth. They'll tell you, okay, get a particular, I don't want to mention the brand because I don't have any affiliation, but people have like Senso. Okay, great. So, good brand, by the way. I recommend it to my my patients. So it's really something to do like, why are my teeth even sensitive right now? Diet comes in. How well did I take care of my diet? Would I taking a lot of fizzy drinks? Would I taking a lot of lemon? Or do I have any condition that has to do with gastric reflux? Can you see how you could have a condition that could affect your teeth? And sometimes, a lot of time, your dentist spots that even before you go to your GP. All right, so now, we're in a situation we have the sensitivity, and there are various ways of taking care of that. Of course, having a toothpaste can help just temporarily, but if it goes beyond that, and of course, the dentist can help you, cover those sensitive areas in a temporary or a more permanent way.
Cover in what way?
Having fillings.
By having fillings? Having
fillings, what we call class 5 fillings, that tooth colored, that will just cover those areas of sensitivity. But guess what? Your brushing technique, a lot of time, I would say 60% of the time, that sensitivity has been created by your brushing technique. Remember, don't brush with so much power. Don't brush horizontally, vertically, and gentle, because you're brushing your gums and teeth.
If you find yourself with a lot of blood, or blood full stop, in the sink when you're brushing your teeth, is that a cause for concern?
It is a cause for concern, but please don't stop. That's a great question, Femi. Because when you're brushing, remember those bacteria that are getting hidden under the gum. They are the ones that are irritating the gum, and the gum gets inflamed by keeping that blood. So every time you're brushing, you're actually locating the areas where you have so much inflammation. If it bleeds, make sure that you continue. Don't stop. Continue brushing for about 2 to 3 minutes more, and you'll see that in a couple of days, that area will stop bleeding. So bleeding is a sign that you need to brush more, not you stopping. Yes.
And
so brush with your eyes open, by the way. Some people brush with your eyes open so you can see.
Do you do any form of tooth extraction? That's the last question.
All right, tooth extraction. We're in this world to prevent tooth extraction, and that's why I'm here, creating awareness, about how important it is for you to visit your dentist twice a year, and every 6 months.
To have to leave it now. Dr. Amy TRAORE Shombusho, thank you so much for being here. President Nigeria Association of Orthodontists. Thank you for being here.